We start this week with Judy Downey. She's the chair of the Relatives and Residents Association. Hi, Judy.
Okay. Hello. Hi.
And welcome to Dialect.
Thank you.
Can you tell us, first of all, what is the Relatives and Residents Association?
Well, the Relatives and Residents Association is a charity. It was set up by a wonderful woman about 20 years ago who was actually quite a posh civil servant. In fact, she spent her first job when she started out working with Nye Bevan, setting up the NHS. So she was very keen on public services being good and looking after older people. And when her mum went into a care home, she found it very good, but what she found tough, and I think we all still experience the same sort of thing, is that when she tried to sort of say what her mother needed or what her mother preferred, because her mother was very old and frail, and although she didn't have dementia, she wanted nobody to make a fuss and didn't want to say anything that might disturb anything. It was Dorothy's job to really say, my mum can't eat pasta, or she doesn't really like to drink out of a mug, and these are the things that she can and can't do. And she found it quite hard to have a good relationship with the home and yet stand up for her mum. And she had the sense to realise that it wasn't just her, but it was very useful for there to be an organisation that could help people with concerns or questions to kind of not make it as personal as it does. Because when I've had my mum in a care home and my mother-in-law, and you really want to get on with them and you want them to like you and you want them to like your mum. But if there's something that goes wrong that you're concerned about, or even questions that you want to ask, the response often seems defensive. Not because people are nasty, but often you're asking the question of a care worker who might not actually know why things are the way they are. And we know here in our organisation what the regulations are, what your rights are as a resident and as a relative. We know what the regulations are. We know what they say about all sorts of things, about complaints or emergencies or food and drink or medicines or records or staffing, and we know the best way to approach it, and we can help people to do it for themselves and give them the power to do it themselves. Or if they feel they can't do it, we'll do it on their behalf. And if the question and the complaint is serious, we raise it with the regulator, and we also try and make sure that the regulator follows it up.
What are the most common questions that people call in with you, call into your helpline with?
Well, there's a huge variation. There's a massive range of things that they phone us about. They phone us about problems with medication, problems where they think the standard of care isn't good enough, where they're worried that their people aren't properly protected. They're sometimes worried about what happens at meal times and if people are fed properly. They worry about sometimes the lack of staff and the lack of staff training. They sometimes are worried about, sometimes they ring up with really serious things like their parents not having been fed or changed or left wet or not being treated very kindly. But sometimes they are just very worried about raising something because a lot of people in the home are very good and they don't want to seem to be difficult. So that if there's one particular member of staff who isn't very kind, they find it very hard to raise that. Sometimes they're ringing up about what they should pay and what the local authority should pay. Sometimes they might be entitled to the health service paying for their care, and they don't know, so we can advise them about that. I mean, there's a whole range of things going from really serious, worrying complaints about poor care and some really quite what we would consider minor things but cause people a lot of heartache. For example, we've had people ringing up who've looked after their mum, say, for years, and then they're terribly upset when they go and see her because she's not wearing her clothes or her hair is looking awful, and sometimes they get terribly upset and terribly angry. And we can say, well, why don't you speak to the manager, or we will on your behalf. And then the manager might say, well, why doesn't she come in and show us? And then there's often a lot of worry and guilt when your mum or your partner goes into a care home, because you feel you failed them because you just can't cope any longer, or they can't cope any longer. So, and we do a lot of listening. We do a lot of listening to people who are desperately upset, because if your husband does go into a care home, or your partner, often you're suffering in your own way from missing them and from the loneliness. If you've been together for 20, 30, 40 years, it's a very big change of life for people.
Now, isn't this really part of something much bigger, which is that over the last, we're probably talking about since the Second World War, that many families before that would have cared for elderly people at home, maybe given up a job or gone over to something like part-time work to look after an elderly relative, and we've become sort of mollycoddled a little bit by the welfare state taking the responsibility off of our shoulders.
If only. I don't think that that's true at all. When I first started work, people were considered old in their 60s, and if you lived beyond your 70s, you were considered really old. And, I mean, if you look at the age of retirement, I mean, you know, policemen were stopping work at 45, and it was a kind of complete... We weren't as healthy, we weren't as well looked after, we didn't have the NHS, and we didn't have often the longevity, the long life we have now. People going into care homes now aren't in their 60s and 70s. They're more often than not in their 80s and 90s and 100s. And they're not just a bit frail or a bit, you know, they've got a bit of arthritis. Usually they've got 70+% of people going into care homes have dementia, and sometimes double incontinence, and sometimes heart and lung diseases and arthritis and Parkinson's on top of all of that. The population of care homes is now quite ill, quite frail, and often very confused in their mental state. I never thought that my mother, my beloved mother, who was a strong, tough lady, lecturing me even in her early 80s about what I should and shouldn't do with my children, once she had her stroke and got more and more confused, and then, you know, I took her to live with me because she was upsetting the neighbours by ringing their bell at 3 o'clock in the morning. I put her in one of my children's rooms, and she couldn't remember where the loo was in my house, so she sort of peed in the corner of my daughter's bedroom, tried to wear my daughter's clothes, you know, who was a little girl at the time. I mean, you know, the doctor said to me, one of you will end up in intensive care, and it won't be your mother. You know, it's pretty unrelenting looking after someone who doesn't know the difference between day and night and can't control their bowels anymore. It's pretty tough. It's not, and a lot of people are doing that day in, day out, and a lot of them, you know, just are at the ends of their tethers. It's very, very tough.
Now, the other thing, of course, is that over the last 10, maybe 15 years or so, there's been an increasing privatisation in this world. And whereas in the old days, it was seen as something that the public sector looked after, whether that be nationally or locally through local authorities. And now it's more and more the private sector. So I wonder how that has changed the way people and the quality of care people are getting, that elderly people are getting.
Well, it's changed in quite a lot of ways. I'd say that the physical standards have probably improved a lot. When local authorities ran most homes, one of the good things about them, and certainly not all local authority homes were brilliant, but one of the things local authorities did in the past was train their workers and also train the managers. And now that local authorities only run something like 7 to 8% of the care home sector, about 80+% is private sector, and about 12 to 14% is not-for-profit sector. It's largely the private sector that is supposed to do its own training. And we know it's just not happening enough. And the turnover of staff makes it quite hard, even for a good private sector provider, to keep on top of it. And, we think in the Relatives and Residents Association, one of the things we campaign for is for it to be a public sector responsibility, just like teaching, nursing, nursery nurses, teaching assistants. Why should the care home providers have to do the training? It's not transferable, and it's not good enough, and it doesn't provide a career structure so that people can be proud of what they do, have some kind of career progression, and, develop their practice. The teachers who teach in Eton have been paid for by us, and the doctors that work in Harley Street, their education has been paid for by us. And, we think that caring for the oldest, frailest, most vulnerable members of the community ought to be a public sector responsibility, and the government ought to not shy away from it.
So what are the sorts of things that have been going on within the private sector then, and what is it you think makes it so that, for example, they're not giving staff as good pay and conditions and training as happened in the past? This is rather worrying if you're thinking that, that the actual quality of the staff is not so good as it used to be, and if so, why is that?
Well, I think it's what we heard about in the little budget the other day, isn't it? The public sector shrinking, local authorities being given less money by central government, and everybody having to cut their expenditure. So the local authorities try to spend less, and so the care home providers think they get less. We don't think that it's justifiable, whatever people are getting paid by local authorities, that the care home providers don't provide carers with sufficient training and knowledge to do a really good job. But there's no mandatory training. There's a recommended 12-week induction. That's not enough, is it? I mean, you need more than that to be a hairdresser. You're doing a really complicated job in a care home. You're dealing with medication. You're dealing with a range of people. You're dealing with people who need sophisticated care and, tactful care. And you're dealing with a range, as I said earlier, of some very difficult illnesses and conditions, most of which are progressive. So, yes, I think that unless, we all shout for this kind of investment, it won't happen.
How open are these private sector elderly care homes to scrutiny?
Well, there's a regulator called the Care Quality Commission. When I first worked in this field, all homes had to be inspected twice a year. Now the regulator says that it's only poor homes that are going to be inspected.
So they might never
often.
You're saying they may never be inspected if they're supposedly up to standards?
Well, they're going to do paper inspections of homes, perhaps once a year, perhaps more frequently, but they haven't made a commitment about frequency. There is no longer a law, a government regulation specifying the frequency. If you were in a children's home, it would have to be inspected twice a year by law. There is no specified frequency for the inspection of care homes, and we know that some of the homes that we have queries and concerns about haven't been inspected for 3 years.
And also, I know that their government is also dropping some of the rules for care homes. I mean, that sounds crazy since the rules are already pretty relaxed.
They're not relaxed. It's the way that the care regulator, the inspectorate, works that we're critical of. The inspectorate has more powers than the police. They can go in without a warrant at any time of day or night. They can take photographs, they can take evidence, they can interview people. What we are very upset about, and why we caused a debate to happen in the House of Lords about a month ago, was that the government has dropped 3 key regulations that we think were terribly important. the regulation saying that everybody must be told about the complaints procedures. Not enough to say we've got complaints procedures, but people must be told that they're there, because the average relative and the average resident doesn't think first about complaining, but they need to be told that that they have a right to do this and what the complaints procedures are. They also need to know that there's a whole range of regulations governing care that they should know about, and the care home staff and managers certainly need to know about. And they need to know that, for example, in the old regulations it said specifically that you must be given a choice of food. Now it merely says you have to sort of have sufficient quantities of food and drink which are nutritional and balanced, and that was in the old regulation, but not with in the old regulation you were told you must be given a choice. That's pretty important for people. For a lot of people in a care home, food is often the most important part of the day, so we've been campaigning very strongly that we want those regulations reinstated. We also want the regulation that used to be there in the past, which made the provider have to write a report every month on what was happening in the care home, and somebody actually representing the provider, not the manager, but an independent person had to go in every month to check that the home was doing what it said it was going to do. And they had to write a report to the regulator, the inspectors that means, and to their fellow directors, if there were other directors, and to the care home manager. And they were supposed to interview residents and staff and talk to people, so that the kind of scandal we had when the Southern Cross homes collapsed, where there wasn't enough heating, there wasn't enough food, and there wasn't enough staff in some of the homes when they started to run out of money. I mean, all the providers said, well, how could we have known? But if they'd had to do this regular reporting, how could they could have been prosecuted for not knowing.
Now, there's also recently been a case, hasn't there, where some relatives of an elderly person in care actually had to put a CCTV camera, install one in the room, and found that that their elderly relative was actually being abused by one of the people who was supposed to be caring for them. Yes,
we were actually involved in 2 panorama programs. They were our clients who were featured in those panorama programs, and the sad thing is that they had complained to the regulator, they had complained to the care home manager, they had complained to the local authority and got nowhere. So in desperation, they'd put the camera in secretly. But but what about those residents who don't have relatives? 10% of residents in care homes, we think, don't have any kith and kin or people in regular touch with them. We did a survey a few years ago showing that, and I don't think the situation's changed very much. That's 40,000 people with nobody looking out for them. And if it was a child, you'd have to have a social worker. You'd be considered a child in need, and there'd have to be someone who reviewed your care regularly. Older people don't have that privilege.
That's quite incredible. Tell us a little bit more about the person who it was, you didn't mention her name, that founded your organisation, who worked with the original welfare state creators back in the 1940s.
Her name was Dorothy White, and she was quite a character. You know what they say, if you want something done, you ask a busy woman. She was one of those. And she actually felt that when she died, the 1997 Labour government had just been in power for a couple of years, and she was a sort of old Labour person, but she felt that they weren't giving enough importance to older people's services, either within the National Health Service or in care homes, and so she became an even stronger campaigner. But sadly, she died towards the end of the century, but she certainly made her mark on impressing upon everyone that met her that this was a cause worth fighting for, because she went to the other existing charities for older people, and they all said, "Oh, you don't need a charity like that. We're already doing it." But we're the only national charity that focuses entirely on residential care for older people, and we get throughout the year we get hundreds and hundreds and hundreds of people phoning us, and most of them are at the end of their tethers because it's taken them so long to find us, because we're not a well-funded charity. And, if any of your listeners have got relatives in care homes or are interested in the topic, we need more members, and we need, even people who want to be on our mailing list or receive our bulletins so that we can keep them in touch with what we do. And, we certainly need to spread the word about the rights of older people in care, because, compared with being in a hospice where there are massive resources, there are all sorts of specialties going in, there's physios and there's occupational therapists, and the drug regime is managed very carefully, and you get experienced doctors and nurses. I mean, in some care homes there might not be more than one qualified person. That's really not good enough. You only get one chance of dying, and it ought to be, the best possible experience at the end of your life, not a sad one.
It sounds like Dorothy's still quite influential through what you're doing. If you had the ear of the Secretary of State, or even, dare I say it, you were the Secretary of State, Judy, what one or two changes would you like to see to the current system in order to start making it work for elderly people? And particularly, I think you're right in pointing out there are so many elderly people in care who don't have a relative to check up on what's going on in their home.
Well, I'd do two things. I'd make residential care in care homes be financed exactly the same as the NHS. We don't understand why, if you've got dementia, which is a horrible progressive disease, you have to pay for your care or have a means test for your care, when if you have several cancers, one after the other, it's taken for granted. Whatever age you are, whether you're 18 or 80, the NHS will look after you, and generally pretty well, and generally with some expertise and up-to-date knowledge and equipment. We think that it's quite wrong, and it causes absolute havoc, just as we have now all this stuff about labelling older people in hospital as bed blockers. How dare we call people in hospital bed blockers when it's a question of the local authorities not being able to find a place or find the money for a place? If it was a child being kept in hospital for no reason at all, there'd be an outcry. If it was all one budget and paid for all by taxation, that wouldn't happen and couldn't happen, and we might get the kind of expertise and training that we get in other aspects of care. And the other thing that I would change, if I could, I'd have a plan for the training of workers in the care sector, so that there was a proper training regime, a proper curriculum, and a 2-year course like they have in some parts of Scandinavia, which you got qualified in and, did a mixture of practice and learning, and you got qualifications, and so that we'd have a qualified, respected workforce. Because now we know from research that the vast majority of those wonderful people who work in care homes and do a jolly good job most of the time don't even confess to being care workers because of all the stories about abuse in the press. And that's really sad. People don't actually admit to working in a care home. And we've done a lot of work. We've produced something called Keys to Care, because we were so worried about the way that care workers got trained, and they're sort of little plastic cards on a ring that are laminated called Keys to Care, and they cover 12 topics about care, going from dementia to listening and talking, or continence care, or care plan, and care at night. And with money from Comic Relief, we've produced those, hoping that the care homes would buy them and use them. But on the whole, we found small care homes might buy them, and a lot of relatives are interested in them. And, we hope that, you see, it also helps care relatives know what should be done in the care home, because a lot of them don't even know what to expect and what should happen. For example, they don't know necessarily that the care plan should involve the families and should include details of medical information and people's needs and preferences about their family and friends, about identified risks, about the goals, and positive things about the resident or prospective resident, and also it gives permission to the kind of care worker to ask questions about the care plan, say, because a lot of the care plans might be kept in the manager's office, and if the care worker who's on duty doesn't know what's in it, they can't do their job very well, can they? So we give them their kind of little hints and tips, and so we don't just moan, we do stuff to make things better.
Just finally, Judy, is there anything that you think that relatives should be looking out for if they're visiting their elderly friend or loved ones in a care home? Any sort of telltale signs that you think may possibly indicate that they should take a closer look at the care that's going on?
Well, I think that if they're looking for a care home or looking or somebody's already in the care home, we think the most important thing is the relationship, just as it is for those of us who aren't in care homes. What the atmosphere is like, go at meal times and see how people are fed, if they're being helped kindly and nicely and not left alone to eat if they've got a tremor or if they've got dementia. I mean, people with dementia often think they've eaten when they haven't, or sometimes want to eat too much because they can't remember. So if that's done kindly and, with proper one-to-one care and concern, that people look happy and relaxed, not nervous and worried, that the people who might be a bit immobile are helped to get up and out, that there are things going on in the care home and people coming in and out in a friendly, happy and relaxed way, and that, if you ask about something, people respond in a friendly, relaxed way and aren't immediately defensive and worried. I mean, we've had a lot of relatives who've asked perfectly reasonable questions and then been told by the manager, well, if you're not happy, here's a month's notice. And people don't want that. They want a good relationship, but it's important to look and listen and, get in touch with us if you think there's something that you need to know a bit more about. And if you're, seriously worried about something, get in touch with the regulator or get in touch with us and we'll refer it to the regulator. Don't put up with rubbish, expect the best and, but obviously treat the staff with the kind of politeness and decency you would like to be treated with, but and ask to see the person in charge, because the care worker won't necessarily know. They might be an agency worker who hasn't been there very long. So don't, just as you wouldn't, ask the first person you met in a school about what the school policy was, don't assume, and don't assume the worst, and assume that the people there are there to do a good job. Don't get up in the morning to do harm, but don't accept rubbish, don't accept poor care, and, stand up for your relative in a decent, polite and honourable way.
And if you want to know what your rights are, I could suggest that people get in touch with you, Judy. info@relres.org. That's info@relres.org. And that's also your website, relres.org. And I know you've got a helpline too, haven't you?
Yes. That's 0207 359 8136.
Okay.
And it's 9:30 to 4:30, Monday to Friday.
Okay, so that's 0207 359 8136. So, Judy Downey, Chair of the Relatives and Residents Association, thanks very much for joining us on Dialect.
Thank you for inviting me. Bye-bye.
And we'll also give the number again at the end of the programme.
Brilliant.
You're listening to dialectradio.co.uk.